Okay guys, now we're getting ready to go into a groin tape job or a hip adductor tape job. The goal of this is to prevent excessive hip adduction. Most often we'll do this wrap in our soccer athletes. It's typically where I see it most often. Sometimes you'll see it in basketball, specifically in the defensive slide position, but most often, I say 9 times out of 10, this is most often for a soccer athlete. So a few things happen before we can start this tape job. We need that tape block on the heel. And again, that's just to create muscular contraction so that we aren't too tight and we don't cause a lot of muscular cramping. And the second thing we're going to be using is an ace wrap. Now there are different size ace wraps. This is a 6-inch, but you certainly could use a 4-inch ace wrap if you so chose to. I like the width of this because it covers more. What we're going to do is start about 4 finger widths above the superior pole of the patella. So if we're 4 finger widths above that, most often our ace wrap won't slide down as they're participating. So what we're going to do, is start laterally and we're going to wrap medially. The other thing that I should state is that patient's foot should be in internal rotation. So we want that foot pointing towards the midline, right? And the reason for that is because it's going to shorten the muscles, which is what we want. We want to shorten the muscles so they can't lengthen. So on an internally rotated foot, we want the patient to be standing on a block with their calcaneus. And then last but not least, we want to wrap from lateral to medial. And you guys can see as I make that medial pull, I'm pulling that foot into internal rotation. It's the one way that I remember which way to wrap. So we're going to keep wrapping, and as you guys can tell, I'm half lapping everything, okay? There's a half lap. We'll keep going. And a trick of the trade for guys, one thing I've learned about guys is obviously they have a different anatomy type. So a lot of times what I'll tell guys is, hey, I'm getting ready to get into the groin area. If you would like to shift, go ahead and do that now. So I'll allow them time to shift so nothing gets caught in the wrap. For females, it's a lot easier. So as we get to the greater trochanter, what we want to do is actually cross the patient's hip. So what we're going to do is go just above that iliac crest. And we're going to come here, and then what we're going to do is wrap it back down. Does everybody see that? And it's okay to get a little fold in there. Let the wrap do what the wrap wants to do. So we'll go across the hip one last time. And then we'll end the wrap distally. So what I'll have my patient do is say, hey patient, can you hold that there? And then I'll take my stretchy tape and I'll use it to close off the tape job. Thank you.